few years, Hong Kong ranked as the most efficient healthcare system in the world, according to the Harvard Health Index, which ordered 89.9 over 100. However, there are more and more concern and dissatisfaction about the Hong Kong public healthcare system because there is a lot of complaint about the public hospital. So now we would like to have a look into what's happening now in the Hong Kong public health system.
I have a rare lung disease called LAM. I have breathing difficulty and chest pain. On top of that, I have poor lung functions, which strongly affects my life. I was hospitalized for almost a half year because of my deteriorating conditions. Seems LAM is not a common disease in Hong Kong. The doctor spent so much time trying to figure out what happened on me and the cause of my serious breathing difficulty. The nurses had no idea how to look after me. Dealing with my symptoms, I think they tried to help me, but the nursing care I received was not enough. I was so confused and worried during the whole time. Most of the nurses were not able to address my inquiries or not to mention my feelings. I was on oxygen therapy up to 7 liters per minute. I was bedbound for months. It was such a difficult time when you're grounded lying on the bed. I understand it's for the best of me, but it was so boring at the same time, so torturing. There's not so much entertainment in the hospital, but staying in the hospital. So it's kind of disappointing that the nurses are actually not that as supportive as I expected they would be. The lung transplantation took me two years waiting. Which is so long. I understand that the demand of organ transplantation has been always high. And in addition, the support in post-operative period was not enough. The lung transplantation took me 2 years waiting, which is suffering. I understand that the demand of organ transplantation has always been high in Hong Kong, but it's another disappointing experience, and the waiting for the physiotherapy session after operation is also a nightmare. So I didn't attend any PT sessions at that time after discharge. And there was almost 40 patients in an OT ward, but there were only 6 nurses, so there's a huge demand for the healthcare professions, but so the nursing care I receive is strongly not enough. So to sum up, the hospitalization it sucks.
Resources for medical system given by Hong Kong government is inadequate. The resources for the patients with rare disease are much less, and the public hospital, usually we don't have enough manpower to provide high quality and specialized service for our patients. We do want to provide a personalized care to them. However, it seems impossible for us. We are exhausted and work under a stressful environment, and we have nothing to do in the ward, in the specialty units. Some nurses, they may get frustrated and even scold to patients. We never encourage this behavior, but I understand why this phenomenon happens in Hong Kong. Specialty rotations may contribute to nurses' inexperience in specialty units. I think that if the specialty units have enough nurses who are experienced and well-trained in specialty, it facilitates those non-experienced nurses to learn and provide a professional, high-quality care for patients as well. Their experience makes them know how to express caring in their attitude in their daily care. In fact, it is difficult to make those experienced nurses to stay in public hospital. The loss of senior nurses is one of the roots of manpower shortage and patient dissatisfaction.
In order to evaluate the current healthcare system, we would like to apply Donabedian's theory of three dimensions of quality care. We analyze the situation according to its structure, process, and outcome. Let's begin with the structure. There is a lack of policy support and resources support on rare disease. According to Hong Kong's domestic health account in 2013 and 2014, the total expenditure on health amount, which is Hong Kong millions 123,828 as 5.2% of the GDP. From 2016 to 2017, the medical and health expenditure in Hong Kong totaled at 57 billion Hong Kong dollars. However, the investment in healthcare has been strongly dictated by the criteria such as patients' number, clinical evidence, and cost effectiveness, causing a sizable number of patients being neglected by the system, most detrimentally those affected with rare disease. Besides, there are lack of policy support on rare disease. Currently, there are 7,500 patients living with rare disease in this city. However, the drug treatment is only available for around 500 cases. Places like Taiwan and Japan have implemented policy to cater to the need of people suffering from the rare disease. In contrast, Taiwan has long shown utmost support and commitment towards their rare disease patients' needs and concerns, and devised a comprehensive medical care policy to address the issues faced by those patients. Taiwan's definition of rare disease is having a prevalence rate of fewer than 1 case 10,000 people. While in Hong Kong, government has not yet put a definition to rare disease, let alone policy or support. As a result, relevant medical services are fragmented and lack of coherence. As there's no specialty for the rare disease, most of the patients are followed up by the clinical geneticists. As for manpower division, one doctor is currently serving 526 citizens, and one nurse needs to serve 141 patients. The ratio is absolutely above the international standard in a bad way, which is set as 1 nurse per 6 patients. So far, specialty genetic disease or rare disease have not been developed in public hospital in Hong Kong. Clinical genetic service is only provided by DHCU Hong Kong U, but not in public hospital. Worse still, there are currently only 2 consultant geneticists registered in Hong Kong. As for the process, there are superb performance in both technical process and in interpersonal process. Due to the policy of ward rotation, nurses are designated to be transferred ward to ward. And this policy was proposed to encourage nurse exposure, but instead it can draw some inconvenience to both nurses and patients. Nurses who are newly transferred to new specialty actually did not attend any specific training courses, let alone coaching. And nurses who just got familiar with the word got reassigned again. This brought not only stress to the ward staff, but also the inconfidence in patients. Due to the stress and rush of time, nurses have to save the time to finish the task in the ward. Communication and empathy to the clients are always neglected, and hence, therapeutic relationship cannot be established easily. Consequently, outcome of the service was jeopardized. Overall speaking, local healthcare service is reached the standard of acceptability, accessibility, and availability. One of its dominant strengths is its low price, which ensures accessibility to citizens from every social status. However, due to the lack of resources, manpower, and time, patients are often feel dissatisfied and their individual needs cannot be addressed. Poor communication skills added fuel to their discontent. Nurses' lack of their knowledge in specialty on rare disease could not be deterred patient recovery due to the incomprehensive patient education, especially when they are being discharged to home. Patients often found instruction is very unclear and confusing. In order to change the current situation, nurses should step up to take up the leadership role by applying the Lewin's change model. Changes are constructed by unfreezing, changing, and refreezing. First of all, to unfreeze the situation, leaders should convince their teammates that change is necessary to reduce their workplace stress and raise their work performance. At the same time, leaders should assess driving and resisting force, like administrative costs and inertia from senior staff. Then, to induce the change, as a system, policy, and resources should be provided for rare disease. Let's start by taking an example from the foreign country and define rare disease. For example, EU define it as less than 5 patients per 10,000 population, and Taiwan defined as less than 1 patient per 10,000 population. Also, expand the definition of person with disability and include the rare disease patients, which makes them eligible for related services and support. Then, which can provide financial and family support for patients and caregivers. Furthermore, we should encourage staff to continue education in interested field, allowing staff to prioritize their preferences of specialty before ward rotation. According to two-factors theory, work performance can be boosted by motivators like interest in work. Allowing staff to choose their desired specialty could possibly motivate them to further their study in that field, and also boost their commitment, which is a win-win situation. Nurse consultant or ward tutor could be placed in every ward and provide extra guidance and training for nurse newly transferred. As for physician, the Royal College of Physicians suggested a ratio of 2 genetic specialists and 4 genetic counselors to every 1 million of population. Hong Kong has a severe deficiency of specialty services. Specialist doctors with training in clinical genetics are lagging. Resources allocation in professional training and manpower establishment is crucial to meet the pressing demand for clinical genetic services among rare disease patients. We, as a nurse, should initiate changes as well. According to path-goal theory, in a demanding environment such as hospital, leaders should be supportive instead of directive, providing guidance on possible way to provide care, also participating in supervising the subordinate to do the task, regularly review the performance of the staff, giving positive feedback and psychological support to promote desirable optimum level of nursing care. As working environment is stressful, and the work is challenging. Leaders should adapt supportive leadership pattern. By showing concern, being friendly and approachable, staff would be motivated to excel themselves in their goal. Just being a less harsh to the colleague, the working environment could be slightly de-stressed. Working with less stress could facilitate nurses to show empathy and employing better communication skills. Lastly, to refreeze the status and consolidate the changes, leaders should help staff to foresee the advantages they can receive from the new system and change. And facilitative and nurturing system and climate supports nurses in coping with stress at workplace. During the changes, leaders should identify difficulties for nurses to further their study and adaptation for ward rotation. Organizing their effort, we should also keep everyone informed and celebrate the success together.
Inadequate resources, manpower shortage, and enlarging patient population has become the three major obstacles in Hong Kong public healthcare system. Hong Kong citizens over-rely on the public healthcare system because of its comprehensive service with a very low charging fee. Manpower shortage of nurses and doctors have aggravated the stress and workload of frontline medical staff. The capacity of public healthcare system has come to its breaking point. And now public hospital has become into crisis.